Thank you so much. And ladies and gentlemen, on that note, it is now time for us to go ahead with our next speaker. And trust me, you do not want to miss, as we're going to be calling upon one of India's most distinguished research and innovation leader, renowned for his transformative contribution to science, technology, and intellectual property. He has served as a Director General of the Council of Scientific and Industrial Research, President of the Indian National Science Academy, Chairman of the National Innovation Fund, and the President of the Global Research Alliance. Also, allow me an opportunity, as I'd like to tell that he's not just a Padma Shri, Padma Bhushan, but a Padma Vibhushan recipient as well. He broke Dr. Kalam's national record of holding 48 honorary doctorates. He thereby has 51 honorary doctorates to his name, highest for any Indian engineering scientist. Also, he's the only living Indian scientist today who has achieved the Fellow of Royal Society, Fellow of US National Academy of Science, and a Fellow of US National Academy of Engineers in this country. Allow me an opportunity to now invite on stage none other than Padma Vibhushan recipient Dr. Raghunath Mashelkar.
Thank you very much, distinguished dais, ladies and gentlemen. You know, if there was a measure of intellectual capital per square foot, I believe this auditorium is the one which will stand out with that. I'm a great admirer of our IITs, our IIT alumni, the nation building that they have done. They have done the nation proud, and I consider it a great privilege and a great honor to be here amongst you. The title of my talk came very easily because we were talking about making technology work. I just had to add the word poor. Making high technology work for the poor. That's the big challenge. And that is what I'm going to speak about. So when you look at making technology work for the poor, I'm going to make it very simple. There are three categories in which we can look at the way technology works. The first is more from more, for less and less people. What it means is that you make high technology work for the poor, for the rich. You know, you have better and better premium models and varieties. They become more and more expensive, and less people can afford it. The second is actually less from less, and that can go for more and more people. It means making low technology work for the poor. We call it jugaad. Somehow that there are some knockdown technologies, lot of compromise made on safety, sustainability, aesthetics, and so on. I don't like jugaad, I must be honest with you, because that doesn't fulfill the aspiration of the people. And the third one is more from less for more and more people. That is making high technology work for the poor. Now this concept may not be easily understandable, but let us look at the artificial limb. If you see this, there is a $10,000 foot. How many people can afford it? 700 million people having $2 per day income. Divide 12,000 by $2. What is the number? Those many working days. Can't afford. So this is MML. That's what I meant. The second is, of course, you have wooden foot. Less and less for more and more people, basically. That doesn't work. But what is most important is more from less for more. Actually, having a foot which can perform miracles. The next slide actually shows you this Jaipur foot. It's magic. Just see how flexible this particular foot is. he climbs, and then you can see he jumps. And when he's asked, did it hurt? He said, no, not at all. And then look at what he does.
Below knee level, above knee.
He runs. And he can run a kilometer in 4 minutes 30 seconds. So what has he been able to do? I want you to think about it, recall your own running, and please raise those hands who can do a kilometer in less than 4 minutes 30 seconds. Please. Come on. Few hands, yes. I can see 1, 2, 3, 4. Oh, on the dais also. So I don't know what is the size of this audience. We were supposed to have 1,500 people and 5 hands went up, maybe 10 hands went up. What does it mean? It implies that he defeats 99% of you. Had you given him a wooden leg, he would have been crawling and taken hours. Had you offered him $10,000 food, he could not have afforded it. His lifetime would have gone in buying that food. That is the power of MLM. More from less for more. And I remember, actually, I started talking about more from less for more in the ATSA Innovation Forum lecture in Canberra, the Australian Academy which had honored me with a fellowship. And I coined the word Gandhian engineering. What was special about Gandhian engineering? There are 2 tenets. The first was, earth provides enough to satisfy everyone's need, but not everyone's greed. That means get more from less and less by using less and less exhaustible resources, get more and more out of them. And the second was, I would prize every invention of science made for the benefit for all. That means for more and more people. And in fact, Gandhian engineering is very simple, getting more performance from less resources for more and more people, as simple as that. MLM, as we call it. Now this MLM does a magic because it gives access equality despite income inequality. That's an oxymoron, isn't it? How can you get access equality despite income inequality? But I'm very proud to say India has done it. High quality hepatitis B vaccine 40 times cheaper, not 40%, 40 times. You would say, come on, it can't be high quality. Sorry, 40% of the UNICEF supply came from this vaccine. High quality cataract eye surgery, 100x cheaper. No, sorry. If you look at the best institution in eye science and surgery in England, 7 out of 7 parameters post-operative, they were written by the Arvind Eye Care. Look at the high quality open heart surgery, 20 times cheaper. Narayan Rudalaya, it's incredible. And the post-operative performance, post-surgery performance is better than the New York doctors. And the high quality artificial foot, 300 times cheaper, but beats 99% of you. As simple as that. That is possible. And I'm very proud to say these are no dreams. India has done it. India is a 10x country, 10 times better, 10 times cheaper. Now, MLM mantra, I remember I started talking about it, and C.K. Prahlad and I were on common boards, we talked about it. And this particular paper in Harvard Business Review, July-August, was ranked among the top 10 must-read papers in innovation. And in this paper, we could actually show, and remember, what does Holy Grail mean? Holy Grail means something you desperately want, but very, very difficult to get. MLM is something that you desperately want. Affordable excellence is what you desperately want, but very, very difficult to get. That was the paper, and we did it because it was Harvard Business Review. What businessmen can do, because it's always doing well and doing good. Can we do well by doing good? That was the basic thesis. It was very, very well received, to an extent that the World Economic Forum had a special session on more from less for more within few months after this particular paper appeared. And I took it up in a missionary zeal. I remember first I spoke in Canberra, in Melbourne. Then I remember in the US, I spoke in Washington, for example, World Bank, and I remember they're setting up special programs on inclusive innovation. The Vietnam Inclusive Innovation Program of $50 million, for example, came very, very quickly. I remember speaking in Bangkok, Kuala Lumpur, Manila, Asian Development Bank. They created a program. I remember speaking in Europe, and Brussels, European Commission had invited me to speak on this. And I remember in their Horizon 2020 program, they included this affordable excellence, not frugal innovation, not jugaad, but more from less for more. That's very, very sort of different. They incorporated that. China, I remember speaking there, several other countries. Interesting part was in Tokyo, because they were looking at the sustainable development goals and how they can be accelerated and how MLM can actually influence it. I remember speaking at several other places. And while championing all this, it became very clear that when it comes to India, we do require the so-called MLM paradigm to solve healthcare problems. Because the challenge is that of creating sort of technologies which will have this affordability, accessibility, high quality, and finally they are universal. Like you can see, accessibility to the remotest part of the country. The Honorable Chief Minister was mentioning about this, taking rural people to doctor rather than the doctor to the rural people. High quality healthcare of excellent quality and performance using highest technology, and universal. It has to be very user-friendly. That's extremely important. I mean, to an extent where we are talking in terms of just scuff into a smartphone and you know what's happening to the lung. You just look into the camera, something that Honorable Chief Minister was looking at it, and you know your hemoglobin, and so on and so forth. Now, these are impossible looking things, but if you do that, that is transformative. That is game changing. And then you would say, if this is what needs to be done, then what is it that you did yourself, apart from speaking? Well, I sprung into action. I created this Anjani Mashelkar Inclusive Innovation Award. I must tell you about my mother a bit and why it came about, and that's why the responsibility she has thrust on me. And I'm working very hard to come to her expectation. Many of you may know, but maybe some of you do not know. I was born in a very poor family. I was born in Mashel, a very poor village. My father died when I was 6. My mother brought me to Mumbai, this city. She was uneducated, did any kind of work that she could. 2 meals a day was a challenge. I remember walking barefoot until I was 12. I studied under street lights, and the breakthrough came when I stood 11th among 135,000 students in SAC. I got a Tata scholarship, that's how I could study. And then something interesting happened. The rest is history, of course. That Tata scholarship of 60 rupees, Tata did not notice that they missed it. but it made all the difference in my life. So I have this habit of carrying some cash in my pocket all the time. And I remember as a Director General of CSIR, I was in Delhi, and every weekend I used to come, and while going, I used to give the money back to my mother. I never left my research, always did that even when I was DG in Delhi. And when she passed away, we found that all her money was tucked under her saris, in her saris, and with a little note, don't forget where we came from, and therefore do something good for those who do science for the good of the people. That's how this foundation was created. Then there were two conditions we put. This is 14th year of the foundation. I'm not a great believer in best practice. Because when you say best practice, you are following somebody. Following best practice. No. You have to create next practice which becomes best practice for others. So awards that were given were only for those. We have to set those benchmarks. Enough of following. We have to lead. And second was making high technology work for poor, because making low technology work for the rich, very easy. Making high technology work for the rich, very easy. But making high technology work for the poor. So we had number of awardees. I want to pick up one high technology, and that is AI that we are talking about. Just select one and take you through that. Now you have these big discussions on AI, how artificial intelligence could widen the gap between rich and the poor. 3 reasons why AI may widen global inequality, or how it will make the problems worse, and blessing or a curse, etc., etc., etc. I'm a great believer that this high technology can be made to work for the poor. And I will show it to you as to how this becomes possible. Let's take the first example. Here is Shwasa. This is an AI-powered respiratory health screening. All that you have to do is to cough into a smartphone. So it's a software as a medical device solution which offers early screening of respiratory problems, uses AI-powered analysis of cough sounds to detect and monitor respiratory health. So you can see it is real time. As you cough, you know. It is inexpensive, and I will give you the price tagline. It is scalable, because as long as you have phones, you can cough into a phone. So there are no limits to scaling. It is unbound, accessible, and easy to operate. And you can now see the difference between the best practice and the next practice. The best practice is using spirometry, all right, for respiratory problems using cough biomarkers. And you can quite clearly see the difference. Look at the equipment cost. The spirometer will cost 1.5 lakh. This is zero, you already have the phone. The assessment cost is 1,000 rupees or so. Here it is just 1 rupee. And the time for results is around 90 minutes, and here it is actually instant. This is what I mean by best practice and the next practice. And what is the technology? The technology is that you use cough sounds as markers. You have the standard St. George's respiratory questionnaire, and Shwasa actually can do a disease prediction of COPD, which is chronic obstructive pulmonary disease. It tells you whether you have COVID-19, you have TB, you have asthma, you have bronchitis, and so on. And this is the way the output actually comes up. I will not elaborate on that. But the most important point I want to make is that this is not jugaad. The technology is such that the deep science of it has been published in papers like Nature, journals like Nature, and you can see that here. That's what India needs to do. Making high science, making high technology work for the poor. Not less from less. It is actually more from less. And of course, being health, we have to have the certifications, and you can see all the certifications around the world that this has received. But most importantly, the impact from Indian perspective. As you can quite clearly see, there are government partners now because TB is coming back in a big way. And it would be nice to know by just coughing whether you have a TB or not, all right? And the private partners are coming up like Apollo and CMC Vellore and so on and so forth. And the most important part is that you can cough in a village. And the biggest city, the doctor can tell you whether you have something or not. That's what the Chief Minister was referring to, isn't it? Taking the doctor to the rural people and rural people to the doctor, etc. You can quite clearly see what difference it is making. And then, of course, you look at the 2000 award that was received by these founders. It's called Salsit Technology. Let me move to another one. I'm going to show only a few examples. This is DOSI, and you will be all proud because this was done by IIT graduates, by the way, 2 IIT graduates. I'll explain to you what they did. This DOSI is actually contact-free AI-based remote monitoring as well as early warning system, and that provides actually customizable and timely alerts to healthcare staff and patient's family, and that minimizes, of course, the risk of deaths of patients. What is the technology? The technology is a sensor sheet designed on the concept of ballistocardiography, by the way. And that is inserted under the mattress of the patient, and it captures all the micro and macro vibrations. And the technological validation course has been done. It has got US FDA certificate and so many others. But most importantly, again, high science, high technology, 16 peer-reviewed journals it has appeared in. Now, what is the difference it makes? Look at the best practice and look at the next practice. The best practice and the next practice, the equipment cost, not a couple of lakhs, but just 8,000 rupees. It is IoT sensor-based system which will slip under the bed. Then, of course, the assessment costs are down by a significant number, as you can see, and also the monitoring costs goes down significantly. And most importantly, 80% reduction in nursing time to capture vitals, because that is a challenge. If you look at the ratios of nurses per patient, you know, it is 10% of what the world standards are, as a matter of fact. And therefore, this becomes extremely critical. Very, very importantly, because it is AI-powered, it is able to save lives because there is a continuous monitoring, and you can see this actual data where a sudden surge in one of the vital signs of a 2 was noticed at 2 in the morning, and it notified the night shift manager and the life was saved. So this saves lives. That's most important point. What is the impact? What is the impact it has made? There are 14,000 DOSI beds now, basically, in 200 plus hospitals. There have been so many thousands of patients that have been monitored. So many nursing hours have been saved, and so on and so forth. And these are the 2 IIT graduates, Mudit Dandavate, IITB 2013, and Gaurav Parchani, IITB 2013. I don't know whether 2013 batch people are here, but we should be proud of that, these 2 young people. So that's the second AI I'm showing, what difference it makes. The third one is a intelligent health risk assessment, which is AI-powered metabolic disorder screening. And that's a pre-diagnostic method for early detection of type 2 diabetes, hypertension, and high cholesterol conditions. And it makes prediction of diabetes in early subclinical stages possible. No use after you get diabetes and going there and then finding out and sort of treating yourself, etc. Can you do that sort of in advance? This is the technology. And the way it works, you can see it here. This was the initial version. And actually this IHRA algorithm, the primary principle is based on the analysis of the pulsatile nature of the blood flow through emitted infrared radiation and modeling its variability under the influence of metabolic conditions like diabetes, like hypertension, like dyspepsia. And once again, you can see the kind of specificity and sensitivity very high, and the certifications that it has received. And there is always from best practice to next practice. She created the next practice herself. And this is the next solution by Arca Research, which is actually a handheld, ultra-portable, multi-parameter device that allows convenient, cost-effective, and accurate way of monitoring metabolic health by inserting fingers into a socket of sensors using photoplethysmography. And actually, Arca's proprietary software is able to analyze this data and measure 20 plus parameters related to metabolic health. And once again, best practice to next practice. You can see what the best practice means and what the next practice means and the kind of difference it can make in terms of giving instant results at a fraction of the cost and so on. Is it being used? Yes. The impact is felt sort of all across in the hospitals, government partners, private companies like TCS, Tata Consultancy Services. They have tens of thousands of employees. They now subject them to these and actually then they can deal with only a small fraction of the total who are at sort of high risk. You can see the difference actually it can make. And very proud to see this photograph of this young lady who got the prize in 2023. So this was the third one. And the last one is Save Mom. This Save Mom, you know, when women get pregnant in rural villages, and our Chief Minister was referring to it, they have to sit in buses and cross, go a long distance, few kilometers to do their maternal health check. No need. Senthil, whose sister used to travel several kilometers, he was employed by Google, by the way, and he said, why do they need that? And he created an IoT sensor-based system which provides continuous monitoring and AI-based early risk prediction. The platform offers care to a pregnant mother and her child for 1,000 days for 1,000 rupees, 1 rupee per day. Mind you, the affordability is not affordability. It has to be ultra affordability. 10% would not do. 10x will not do. It has to be ultra affordable. And what does the technology look like? It is like this. There is a wearable that uses the PPG sensors for continuous data monitoring. And the health workers, they periodically record the vitals. And the platform is trained on data of thousands of mothers and predicts risk in pregnancy. In fact, in the first trimester itself, it can tell you whether you are going to have early pregnancy, is it going to be safe, and so on and so forth, etc. Deakin University, their AI, they are very well known for their AI research. They have come and joined now in order to take this forward. I think the most important part is the remote pregnancy monitoring and risk prediction is creating the big difference. And you can see the best practice currently, women lining up as against you just have a IoT sensor-based system around your hand and making a difference. What I'm very proud to see is that Harvard Business School has a case study on this, by the way, on this innovation. They already onboarded 36 lakh women on the platform, 35,000 successful deliveries. They have partnered with 4 state governments. Andhra Pradesh is making it mandatory now. They are working, as we speak, with Bangalore Municipal Corporation to monitor 1 lakh pregnant women, and it is going places. And this is Senthil, by the way. This is in my office. There is a photograph of Gandhiji, and since this was Gandhian engineering, he insisted that we take a photograph with Mahatma Gandhi, who is looking down upon him, as you can quite clearly see. A fantastic Let me end, I will just have 2 more slides. What are the challenges that we face? And I want to be very brutally frank with you and honest with you on this. I think the first is the medical practitioner community is extremely conservative. They don't want this, in fact they don't like it. Why? Because when they prescribe, go and get these tests done, they get certain percentage of those from those people who do those tests. Now percentage of 10,000 rupees is quite a lot. But if you are doing it for 1 rupee or 10 rupee, 10% means nothing, no? So there is a challenge. The second is long scaling period because talent, technology and trust challenge. I'll come back to that. The third one is the ecosystem struggles with adaptation of disruption. Because these are disruptive, game-changing. Things happening instantly, cuff and you know, and the rest of it, etc. And societies don't adapt disruptive, game-changing technologies easily, so as to say. So we are facing that problem. Third is the venture capital. I'm sorry to use the word vulture capital. We need adventure capital. And that is missing. And they need adventure capital. I'm very proud to tell you on 26 September, we had K.K. Ghada, 95 by the way. He passed away within a week. That was his last act. He created a 30 crore fund for the patient capital. People kept on talking about patient capital. Patient capital and compassionate equity. For precisely these, because who would bet on them? Because these are going for values, not for valuations. So somebody has to come and support them, no? And he has created that particular fund. And we have, of course, an MOU. And the government is the key stakeholder, but bound by long processes. I remember when Dozy came in, COVID was at its peak, June. I remember people were dying in ambulances. But when we went to government hospitals, they wouldn't take them. Why? Either there were no budgets, or if there were budgets, there was tendering process. And within that tendering process, 2-3 months, how many people would have died, you can just sort of imagine. So there were challenges of this kind. In our foundation, we are trying to do something by, using the our own recognition, funding, government partnerships, outreach, research and technology development and talent partnership. You can go to the website and see what we are trying to do. We are very proud of these which are already in the market. Many of them are in 10 countries, 15 countries, 20. One of them is in 40 countries now. And my last slide, very proudly, is all these winners from 2011. What is common between them, common among them? Not going for valuations, but for values. They're all more from less for more. They're all for creating access equality despite income inequality. And very proudly, I would say that some of them, I mean, like the, you can see on the right-hand corner, this talent, technology and trust I like to explain. Like you see Naveen Khanna, he had a dengue one-day test. 15 minutes you come to know whether you have dengue or not. US FDA certified, US patent, nobody would take it. Why? Because we were importing from Australia, from South Korea, and from US. Then came pandemic, we ran out of kits. We went to these countries, 2 of them said we can't, South Korea said we will in the time that was there. And South Korea boarded those kits on the wrong ship which went to Africa. So we had no kits. So what was the option? Go for Naveen Khanna's kits. And his market share, which was 0% at that time, today is 75 to 80%. And had the ship come, it would have been 0%. My friends, talent, technology and trust. Let us trust all these people who have been 30 years plus minus 5, and they have done what they have been able to do. And I would say, I like to end that then they are bringing smiles on billion faces, that is their priority, not just chasing $1 billion. Of course you can chase $1 billion as well as bring smiles on the face of billions of people. So it is not about just doing well and doing good, but doing well by doing good. Thank you very much.
Well, I'm sure the applause says it all. Once again, let's warmly applaud him for all his achievements and all his contribution. So with that, ladies and gentlemen,